is a breast lift?
A breast lift is an operation that helps to improve the shape of the breast by putting the nipple and the areola, which is the dark skin around the nipple, in the appropriate position on the breast. When we age, or as a woman ages, the breast may start to sag and droop. When the nipple goes down or descends to a certain level where it does not look right on the breast, then a breast lift operation can reposition the nipple to such a position that it would create a nice looking breast again, a more youthful looking breast.
Who's a good candidate for a breast lift?
A good candidate for a breast lift is an individual whose nipple and areola, or the dark part of the skin around the nipple, has descended below a certain level that is acceptable. This level is usually at or below the inferior margin of the breast, meaning the fold of the breast. Once the nipple goes below that level, you would be a good candidate for doing a breast lift operation.
And how is a breast lift operation done?
A breast lift operation is done by removing the excessive skin that the person has around the nipple and the areola. This is again done in multiple different ways, and it could be done with as short an incision as an incision just around the nipple, but oftentimes you need to take out more skin than that. And when we do that, we can either use a traditional technique of an anchor incision breast lift operation, in which the incision is around the nipple, down from the nipple to the fold of the breast and underneath the fold, or a short incision breast lift surgery, in which the incision is just around the nipple and a line going from the nipple to the fold under the breast. This is commonly called the lollipop incision.
How long is the recovery?
The recovery for a breast lift surgery is less than a week. Most people recover within 5 to 7 days.
And what should a patient look out for?
I think the most important aspect that a person should look out for with respect to breast lift surgery is to try to do the most minimal surgery necessary for her condition, meaning that for most women, it's very important not to have a scar on their breast. And of course, plastic surgeons are well aware of this factor. However, there are individuals who go to have this surgery and end up with more excessive scar tissue than necessary. I think the important thing to look out for is to try to do the most simple operation possible to get your breast to have the best looking shape, and to put the nipple in its correct position with the least amount of scarring.
And how long after a breast lift can a patient get back to their normal routine?
I would say in less than a week they should be able to get back to work. But getting back into exercising and having the level of activity that they had before surgery, I would say is probably going to be closer to 3 to 4 weeks.
What should an individual do if they really want a breast lift done?
I think the first step would be to see a well-qualified plastic surgeon. After they've seen the plastic surgeon can tell them whether they can be a good candidate for doing a short scar breast lift operation. I think that's the best technique out there for producing the nicest looking breast with the least amount of scarring. And at the same time, they can see if for example, other procedures are necessary for their breast as well. There are individuals whose breast requires certain adjustments and positioning problems with the breast tissue itself. And if that's the case, that can be done at the same time. There are other individuals, for example, who need a breast augmentation done in conjunction with a breast lift. And I think that's another important question for the person to answer, because a person may come with the idea that all they need is a breast lift, but when they see a plastic surgeon, the plastic surgeon can tell them whether or not they also would need a breast augmentation, because once the extra skin is taken out, their breast may be really too small. and they may need to enhance their breast in order to get the best possible result.